Welcome to Rebuild, Revive and Thrive, where we're going to dance your way through back and hip discomfort. I'm Lisa Maclean and I'm the founder of rebuildprogram.com.au. We're going to talk all things pain and inflammation. Better yet, we're going to decrease the frustration, we're going to increase the confidence, and we're going to just make getting older fun and enjoyable. So make sure that you like, follow, subscribe, and stay tuned weekly to kick the pain to the curb. Welcome back to another episode where we're going to dive deeper into why age shouldn't be a restriction to you. Now listen, as we get older, things change. It's a given. So I'm not going to sit here and tell you that I'm going to be able to make you feel 20 again, because that's a crock, not going to happen. The 20-year-old version of you is completely different to the 40, 50-year-old version of you. But what I do want to go through today is bringing awareness to you of the importance of moving more as we age. What happens when we get older is we start to slow down and we become less active. By doing this, you're increasing your pain levels and staying in the pain cycle. By understanding you're moving, and increasing strength, stability, coordination means that you're going to be able to move more efficiently for longer. So it's really important. If you are starting to slow down and become less active as you get older, you want to flip it and become more active and understand what exercises you need to do to be moving for longer. Let's go back to the being less active category. If we're starting to slow down, the changes that are coming your way, and this is facts, this isn't just me making it up and making you feel bad. The facts are that your joints will become stiffer. So the fluid inside your joints starts to decrease, the cartilage starts to thin, and now we're restricted through our movements. The ligaments and tendons, your ligaments and tendons are going to start to shorten, so less flexibility. Our posture will change, and that's due to our spine actually being compressed as we age. And that brings that rounded upper back posture that happens as we get older and elderly. Your gait will change. So your stride will actually become shorter. So that's limiting range of motion through your hips and restricting movement through your lumbar. Your muscles become weaker. With muscles becoming weaker, how does your body now provide stability through movement? When we don't have that stability through movement, there becomes a lot of wear and tear and, increase the pain. Let's sprinkle in hormones, because they're going to be sprinkled in either a lot or a little as we get older. And the big one is, the big one that I want you to think about is, as we get older, the decline in the muscle building hormone and the growth factors actually contribute now to the less muscle mass, to the muscles weakening. So without that growth hormone in our system, how are we actually changing and adapting to be better? Also, lack of coordination or loss of coordination, but that's brain and nervous system category. But it's even more vital for you then to realize the importance of balance training, functional training, stability training, because the nervous system and muscles read each other, send each other messages. So we want to make sure that our muscles are supporting our body through movement efficiently. And we don't want falls. That's going to prevent falling from happening. So on that note, right, that's just touching the surface of what happens as we get older and how pain can increase. But take it back to use it or lose it. This actually refers to disuse syndrome. So the inability to be moving, the lack of movement actually causes our muscles to be weaker. And again, like I said, a body that's not stable through movements. So with that lack of moving and the weak muscles, our muscles actually now go into atrophy. And that's where we are just losing strength. Their walking's not even supported. Your spine's not supported. Your pelvis is not supported. So we lose range of motion and we're restricted. We're restricted in our muscles. And with that becomes underactive and overactive muscles. That's going to keep you in the pain cycle. Once we're here, overactive and underactive, we now need to retrain and correct our biomechanics. And remember, that's what I do. I get people out of pain by improving their biomechanics and making their movement more efficient. So this all impacts on our stability, our muscles. And this is the number one cause of chronic back and hip pain. the instability of movements. And it's given to you now as we age if you're slowing down and moving less. If you are able to get your corrective exercises, perform exercises, stability exercises to connect your body, you will be moving better for longer. And that's the end goal, right? I know that I want to be the 80-year-old that still walks upstairs, doesn't have to take the lifts, and I want that for you too. So if you're unaware of corrective exercises, head over to my website, rebuildprogram.com.au. Go into the products where you'll see all the programs with corrective exercises, something for everybody. That's just a goal, right? That's just a direction if you have no idea of what to do. So what are my tips for you? So we've gone through what's going to happen. You're sitting there thinking, oh God, Lisa, I don't know what to do now. Well, number one is that we need to adapt to where we are now. So if let's say in your 20s, you used to run marathons like me. Now that you're older, you haven't run for a long time, well, you're not going to go and do your marathon training. You adapt to where you are now. Consider the factors of your injury, your pain, your movement, your age, your limitations. We need to adapt to where we are now and nutrition, because as we get older, especially with hormones, our gut health changes. So we want to eat less food that cause inflammation. So stop dieting straight up. We want to eat for fuel, and what worked for you when you were 20 won't work for you now. So bring it back to pain levels. It's inflammation that we want to heal and fix, because that gut inflammation actually reflects onto your hip pain. So adapt to your exercise and where you are now. What worked at 20 does not work now. So don't try and pick up where you left off. So we also want, number two, we want to stop the oh, well, it's just because I'm older attitude. So just don't accept pain. We can change pain. When it's structural, we can't control that. But where there's structure damage, there's also muscles that are in trauma. And we can retrain the muscles. Muscles can be retrained in the particular order to improve biomechanics. Again, this is what I do. So go check my website out or book in a call and we can have a chat. But don't accept pain. So many people just put up with it because, oh, well, this is me now. No, don't do it. We need to stay active, keep moving to be moving for longer. So like I mentioned, the hormone changes will happen. And especially in ladies, perimenopause, menopausal or postmenopausal, this brings extra inflammation. This brings inflammation into our joints and inflammation into our gut, like I mentioned. What we do want to do, though, is we want to make sure that we focus on what am I up to? 4. We're up to 4. We want to focus on prehab exercises. We want to focus on mobility work, especially focusing on range of motion. Like I mentioned, if you're less active, we get restricted through our movements. So range of motion is key through your joints. We want to work on not stretching, but mobility work. We want to work on connecting our muscles. This underactive and overactive, we want to change that. We want to actually balance them out, connect our muscles so our muscles have a job role to do. And again, that's through corrective exercises. So that's your prehab work, right? Your mobility work. But number 5, I'm going into strength training. Now, stability and strength are completely different. I put stability into your prehab. Stability is connecting. Stability is teaching your muscles how to respond to movements. Strength work is now going to be able to produce force. That's what we want. But remember, if you are less active, we're having weaker muscles. Our ligaments and tendons are becoming shorter. Ligaments and tendons work well with loaded training. So we must do strength training. Strength training does not mean deadlifts and squats and lunges and, heavy bench presses. Unless you're already doing it and you've been trained and you know what you're doing, don't just go out and do that. Strength training is loading your muscles to become stronger, increase your bone density. But this is for you and your training. And again, if you have no idea, head over to rebuildprogram.com.au and there's guidelines and there's programs and all sorts in there for you. Number 6, improve your posture. Now, that's not just standing up straight, because you're actually just going to cause more harm than good. It's producing a neutral spine through stabilizing through your muscles, protecting through your spine, and also through your pelvis. And if you want more information on that, go and check out my posture episode where I dive a lot deeper into that. So heading into number 7, let me touch base. Sorry, let me go back to posture then again. Creating a neutral spine actually means doing your stability, your corrective exercises, your strength training, also alignment training, again, which is in your prehab training. Alignment means ankles, knees, hips, and shoulders are all working together, sitting, standing, walking with posture, building those muscles up. Number 7, sleep and stress. Now, this is a big one. I can't tell you how to sleep because we're sleeping. Nor can I say live a stress-free life because that's unheard of. There's going to be stresses. There's going to be times when lemons get pegged at your head and we have to deal with it. But that does add to inflammation. When I speak to people about when they want me to help them, when we're doing one-on-one coaching, and they don't factor stress in, but stress brings inflammation, especially through your hips and through your neck and your shoulders. That now brings muscles into trauma. Okay, so just remember that. And sleep. This is where our growth, our repair hormone actually is produced when we have good sleep. So add in, let's just put that mixture. Let's say we're adding in being less active, slowing down, not sleeping, a hell of a lot of stress, and we're not doing any strength training. Do you know, this is just a recipe now for pain. And these are everyday things. So making sure that we focus on sleep and stress. But then number 8, the importance of understanding biomechanics. I don't need you to have my brain. I've studied biomechanics. I treat people with biomechanics. I understand physical therapy. I don't need you to be like me and my brain, but have an understanding of your biomechanics and how you need to fix it. So having a guide, having a step-by-step process for you to know. If you go into step 1 feeling good and then think that you can go to step 10, and I'm talking biomechanics here, you're not going to get any results. So it's a step-by-step process. But understanding biomechanics and how you move and how you need to move and what we need to do to improve it, that is absolute key in results, because it's step by step. So them are 8 little tips for you on what we need to do to improve movement. But take it back to what I said about adapting to strength, adapting to where you are now, your training. Strength goals are going to change over time. And this is a big thing that I teach my people, my clients in my program, in my one-on-one coaching. Your goals are going to change over time. So let's just nut it out, like I said, step-by-step process with biomechanics. Step 1, things, we're going to start changes, realignment, mobility is going to change. Then we move into step 2, goals now have changed. So you want and you need goals to be changing. So don't try and do what you did 5 years ago or 12 months ago. If you've been consistent, goals change. So adapt with that. What worked for you 20 years ago does not work now. And the key to training is doing unilateral exercises. And what I mean by that is single-sided. So working left and right. So this is going to help with your coordination. This is going to help with those muscles firing. And this is going to help with alignment. Don't forget rotational exercises, because everyday movements provide rotation. And if we're just focusing on stock standard front back exercises, we're not strengthening, nor are we going to get out of that pain cycle, because we need to focus also on rotation. And some people in the pain cycle get very scared of rotation, but there's a way that you can train it. So if you're unaware, once again, head to rebuildprogram.com.au and there's information all there. Third thing that when you focus on training and thinking about doing your corrective exercises is compound movements and coordination. Compound movements is a group of exercises. So we're not just doing quads, or we're not just doing one thing. We've got a mixture of lots of exercises, because that's functional training. With all this information, and it's not a matter of, I don't need you just to go out and do strength training. I want you to understand the factors that we need to look at, and then assess your situation of where you are and what you need to do now to move forward in decreasing your pain and building up those muscles. But you can be amazing as you get older. Do not give up on yourself just because we're aging, just because we're another year older and the pain's getting worse. We can retrain. You can be amazing as we age. Your muscles can be retrained no matter the age. I've got, some ladies in my one-on-one coaching program that are 75 and moving well. One of them actually just said to me she went to a wedding and she danced the night away and no pain at all. These things you can actually do. We can retrain the muscles, but we need to retrain the mindset as well. This mind is still not 20. It's not 20. Do you know, it's a different version of you and we need to adapt to it. You need to know that you have to keep moving. It's a non-negotiable as we age, but we need to adapt to where you are and what needs to be done moving forward. So I hope that's helped. I've given you 8 quick tips. I can definitely go through them a lot more if you want. Reach out and we can talk about them. But that's a wrap on another episode. As always, if you've appreciated this episode, go and share it on your socials, either Facebook or Instagram, and make sure you tag me in it. These podcasts, this information is for people who want to be better, who want to move better, who want to retrain their body and get out of the pain cycle. Whether it's you just want to be a better version of you, whether you're an athlete that wants to be injury-free, whether you want to learn more about your body and just be more aware, that's what this information is about. But I'm going to leave you there with this episode. Make sure that you make it a mission for you to be more aware of you and to also be a better you.